it's not enough for you to say, hey, I'm here, I pay you money, you fill my medication, and whatever you give me is enough. I think we're at a point where that's insufficient. When you graduate, you can't sit in the room and expect your client to guide you. If that's the mindset or that's the processes that you go through as a student, I can't imagine your clinical work going to be much different than that. The more popular psychology as a profession gets, the less that people who come into it understand what it's actually about.
Welcome back to Be Kind to Your Mind. I'm Alvin, clinical psychologist and founder of People Psychological Solutions. And I'm joined once again by Dr. Joel Loh, fellow clinical psychologist, former president of the Malaysian Society of Clinical Psychology, and founder of The Mind, a psychological services and training company. In today's episode, we are taking a step back to look at the mental health field in Malaysia, specifically the rapid growth we've been seeing over the past few years. There are now more clinical psychology programs than ever before. More students are enrolling, more graduates are entering the field, and yet we are also seeing a crunch of practicum placements, concerns about training quality, and increasing pressure on the job market. Joel and I have both been educators, supervisors, and practice owners, and we've seen how these shifts are also affecting the profession from the inside. So this is going to be an honest conversation, not just about where we are, but where we need to go if we want a sustainable future for psychology in Malaysia. So, Dr. Joel, welcome back.
Yes, that's Joel.
From 2 weeks ago.
Yeah, feels like yesterday.
Yeah, actually feels like 5 minutes ago. A lengthy introduction was provided in the previous episode where we spoke about your experience as a business owner, more specifically in private practice, us as mental health practitioners as well.
Yeah.
So your introduction was there. But nevertheless, I think today we are going to lean in on your experience as the ex-president of MSCP.
Sure.
So knowing the landscape in industry I think, a more bigger picture. But also, I think as an employer, as a clinical psychologist, you have seen how the field has evolved. And today we're going to speak about the training that we have as mental health practitioners, how the industry has evolved in response to that, and some of the challenges that perhaps we as clinical psychologists and clinical psychologist trainees are facing at this time.
Sounds good.
So let's first start off with the first question about your observations with regards to clinical psychology training programs, perhaps over the past decade or so. What has changed?
Everything. I think the most obvious change is the sheer number of providers. I think when you 1 year my junior, I think from Help last time, right? And I think back then there was only UKM, Help when it first started, and
UIA was somewhere in between.
UIA in between.
It was
right?
Wanted to close, wanted to restart. Along those lines.
Right?
Yeah.
So only 3 providers, so very few options available, right? And I think in a weird way it was really, really good back then, just because then you have a finite number of students and a finite number of resources. So then it was quite even distribution in that sense, right? So I think the biggest change that we've seen in the past decade is the sheer number of providers. I think there's so many private universities that are providing programs now. There are also quite a few government institutions that also have started providing their own programs and all that. So I think that's been the biggest shift, right? And I think whenever you have a private institution that comes into play, that also means that the numbers that they're able to churn out also is a bit insane sometimes, right? So then I think as a segue to that also means that the number of clinicians that are being churned out on a yearly basis also has increased substantially in that sense. So I think those are the biggest changes that I've seen so far, at least from a overarching view in that sense.
Yeah, and I think that changes everything, just from the number of providers of clinical programs. I think pretty much the whole episode will be discussing on the implications of that. Because you're right, we first started off with 2 or 3 universities, and it was capped to 10 students at Help.
Plus minus.
Once per year.
Yeah, correct.
So you're looking at, in 1 year, churning out maybe 30 or maybe 40 clinical psychologists in 1 year.
That's right.
And now you have, last I counted, it was at least 10 universities.
Probably, yeah,
in
you're
total.
right. Yeah.
Both public and private.
Yeah.
And more to come.
Mm.
And you could have 2 or 3 intakes per year,
Mm.
not only one.
20-30 per program.
Yeah.
That's insane.
So some
That's
universities are going up to those
right.
numbers.
That's right.
So you have about maybe 30 psychologists out every year. This was more than 10 years back. And now you're looking at, if every program 10 times, it's in the hundreds lah, many hundreds lah.
I think so. Yeah.
So as an overall then, looking at the differential, is probably 10 to 20 times more graduates churn out each year.
Easily, yeah.
And things change as a result of that.
Yep.
What are some of the changes in response to just this difference in more universities providing the service, more students graduating? I think there's a lot of layers to this, but let's first start off with a conversation about it. So what changes as a response to that?
That's what meaning to say when you have more students coming out, what changes, right? Yeah. So I think the first easiest one is just the supply and demand of jobs, right? I mean, as many students as you're churning out, which is good in a sense that, from a pure number point of view, that means that theoretically speaking, more Malaysians get covered, more Malaysians have access to services, because that's been one of the biggest problems that we've had in the past 10, 15, 20 years ago, right? That we don't have enough clinical psychologists to service the community, which is great. But like they say, not all numbers are created equal. Meaning to say that, there are, as you have an increasing number of students that are graduating, that also means that the range of competencies are going to be increased as well. Especially like what I was saying at the start, right? Like even though there are more and more universities that are coming up, the number of training providers, or at least training providers, meaning to say that, sorry, let me backtrack. The number of lecturers, of supervisors and all that hasn't really increased that much. And I'm sure you're aware about that as well, right? So from having like 2 or 3 centers where there were, let's say, 4 or 5 clinical psychologists teaching these students, now you have obviously it's grown a little bit, but not at the same degree in which the students increase. A small group of lecturers and people who provide education, spread thin over multiple organizations, right? So not only do you now have situations where there are only like 1 or 2 clinical psychologists per education facility, some don't even have any, right? Which boggles the mind, but it is what it is, right? And then that's one part. And I think that scares me to no end, because then I wonder what is the outcome. Yes, you get the numbers, they get the title, they get the certificate or whatever it is. But what do the students gain from the time in the programs? I don't know. That's the big question mark, and that's a scary question mark.
So big picture, among the issues that you've raised would be how the number of graduates, once it's 10 to 20 times more than what it was before, its impact on the job market. So that affects the graduates' ability to be employed or having perhaps the right amount of salary to sustain their living and so on. And then it's the quality of the education and training that they undergo. This is purely based on the number of placements that are available, number of supervisors, the number of educators.
Yeah, that's right.
Because to start a program, you need a certain amount of PhDs, right? MPhil requirement. In order to start the program and to have the faculty teaching the students.
That's right.
And then you have the concern about the quality of the graduates, because if the quality of the training is affected, then what about the quality of the graduates? So let's first, I think these 3 issues, start off with the earlier portion before they graduate. So it's the quality of the training that the students undergo. So back then you have, I think, a more intensive environment. So if you have 10 students in the classroom and you spend pretty much every day together, it is a very intensive process of learning. Compared to now, I think you might have 20, 30 students in a batch. And across the year, you have a few different intakes as well. How does this affect the students' learning journey? Taking into account, I think, in the second year, for those of you who aren't familiar, in the second year, they go off for external practicum. So that's where they go to different centers or hospitals and so on to start clocking in the hours. In the first year, they start off at their university grounds, usually the counseling center there. So they're already getting in experience, going through the training. So given with the changing landscape right now, how does this affect the students' learning journey?
So we talk about pre-practicum when they go out to work in private centers and all that, right? I think when you have so much dilution, meaning to say that there's so many more students to the number of lecturers and training providers that you have, right? I think what's going to happen is that you have a scenario where there are a lot of people who can slip under the radar, right? So like you rightly said, when we first started, I mean, you were the second batch in cohort and help, I was the first batch, right? We only had like 10 of us, and there was only, even though there was only 2 lecturers, because there were only 10 of us running around, that means it was about 1:5 ratio, right? That also meant that the amount of time and attention that these lecturers/supervisors could give us was immense, right?
Yeah.
Like I remember Dr. Richard and Dr. Ng really grilling the crap out of me, right? And making sure that, I was, if not competent, but at least familiar with all the intricacies that you need to be as a therapist, right? And because there were only 10 of us, there was really no place to hide, right?
Yeah.
Whatever you couldn't do well was laid bare for everyone to see. And it was the onus is on you to buck up or ship out. That's just the only thing that you could do, right? So I think when you've got like 30 students coming into a cohort and you have multiple intakes a year, so that means the ratio for the lecturers would be, if you're lucky, 1 to 10, 1 to 15, and I've heard numbers bigger than that as well. That means also that the capacity or the ability for these educators, to give them the appropriate attention, to spot people who are struggling, who need help, is going to diminish naturally because they just cannot. And I think that means that people are going to fly under the radar. And when you fly under the radar, then something's got to pay the price, whether it's their ability to graduate at the end of the day or the work that they do with the clients in the future, in that sense. Right? And I think that's probably a big problem that we're facing right now. And to be fair to the education facilities, the universities, it's not for lack of trying. They are trying to hire competent lecturers and all that, but we just don't have them, right? Like how, like me, for example, and maybe you to a certain extent as well, I'm not sure. We entered the field because we want to practice. Yeah. We want to work with clients. That doesn't always translate very well to becoming a good educator, right? My business partner like to say, right? You do the job well doesn't mean you teach well. They're two separate things altogether. Right. So when you have that kind of a situation and you don't do, how many people do clinical psychology because they want to teach? Not that many, right? You can't shoehorn a practitioner into an educator. You can try, but it's not always going to work out. That engenders more and more problems, unfortunately. So it's lack of resources as well.
And so, given the number of new programs coming up, you're looking at younger faculty members.
Less experienced.
Mm-hmm.
Yeah.
Mm-hmm. But I think, I completely agree with what you have shared about how the faculty members might have more limited attention towards individual students. But I think those not from the field, as they are hearing the numbers, to them they are thinking, not bad what?
Yeah.
One
lecturer
right. to 10 or 20, 30 students, actually
sounds
okay.
Okay. Yeah.
Sounds okay.
That's right.
But I think because in order to develop a clinician, a competent one, the level of attention that's required is actually very, very high.
That's right.
And I recall, starting class from 8 a.m. to 6 p.m. But then we stay with our classmates till at night because of all the articles that we have to read before early morning. We are supposed to have a discussion about it already. So it's like a whole day of studies and discussions.
Perpetually, that's right.
And then practicum comes with supervision and so on. The level of attention that's required is really high to develop a competent.
And I think it's rightly so as well, because this isn't a job where the repercussions is that you put in the wrong number or you put in the wrong part. The repercussions are people's lives, right? I think the same level of scrutiny that doctors go through, we should be, maybe not on par with that, but on the same level or same intention, because whatever we do in the room is going to matter in someone else's life, right? So it should be that way. It should be scrutinized to that extent,
So definitely, I think I completely agree with you that the attention received by every candidate in clinical psychology now is definitely much less than the kind of attention that we have received earlier on.
That's right.
Aside from that, I think given that the intake sizes have increased, number of intakes have increased, number of universities have increased, as a supervisor as well, I am noticing over a period of time, the candidates in clinical psychology have also changed
Yep.
because the selection criteria now, I think now you have to cast a wider net.
Yeah.
Last time, I think the sort of the profile of a of a clean psych is quite standard lah. In terms of selecting the candidates. But right now, I'm hearing perhaps some programs also might struggle to put in the numbers.
Yeah.
So I need, management says 30 students. And I'm only meeting like 20 plus. I likely want more, but
minimum would be that number.
Yeah, right? The applicants maybe is really unsuitable, or there's not enough applicants.
Yeah, that's right.
So I think the sort of the selection process has also changed. And so we are looking at students who come into clinical psychology, and if they are subject to the kind of treatment that is required, maybe you are looking at unsuitable candidates as well.
Dropout rates and things like that. That's right.
So that is also, I think, another factor that happens as a result of this change.
This is a point to add to that, and this is a personal thing that I'm very sure, right? Like I said before in the previous episode, if you want to watch that out, check that out and see. I love the profession. I really, really sincerely do love the profession, right? And I think it really hurts me when people get into the profession because it's popular, or it's because my parents say it's a good thing. Like, you don't do it because you want to. You do it because it's convenient, or it's the new in thing, right? And that, like it or not, that's going to result in clinicians that are of different intention, of different desires, like in the work that they do, and it really hurts me, right? Like, it's almost becoming a profession where people do it just because it's popular, and it just drives me up the wall. I cannot tahan.
So I think passion is a factor here, and also in the past episode we talked about ethical practice. This has to do with, I think, a deeper, like, our identity.
Correct, your calling, I suppose.
In the way of how we make decisions with our clients. How we choose to persevere and carry on in terms of professional development and so on. It comes with a part of our identity that aligns with the field. But I think you're right. Over some time, I've also supervised some students by now. We could have students with perhaps a different level of motivation or different sort of purpose as to why they are in the program in the first place. And it might be unrelated to their personal interests, or it might be unrelated to their passion towards the field.
That's right.
I'm getting more and more, for example, trainees who might be ambivalent about the whole thing. I'm not even sure if I want to do this or not.
Correct. It's a 2-year master's, man. Like, you don't know what you're doing. It's not easy masters as well, but you're right. It does happen a lot, unfortunately.
And then the candidate goes on, right? So you have like the selection criteria as well as the attention by the educators. And then they go on into practicum placements. And then this is another set of problems, because now you have the number of practicum placements, I suppose, have increased a bit, but probably not in tandem with the number of master's programs.
That's right.
So if, let's say, it's increased 50%, but master's program increased by a few 100%.
200%,
So then there's a misalignment of how many placements are available for students. So what happens here at this stage with the students?
So, I mean, at the end of the day, when you are a clinical psychology student trying to get the hours, or if you're an education provider, the remit is that you need to get these students the hours, right? So what you'll find, or what you start to see, is that people get placed to more and more interesting / creative sites, right? Which may dabble in some therapy, some clinical work, but not necessarily all the time, right? So which also means that the amount of training that these young practitioners get also gets diluted as well, right? And I think that's a product of, like you said, the increase in sites is not in tandem. But I think there's also one more additional problem as well. So even though the number of sites are increasing, the number of quality sites, quality supervisors, that definitely has not increased, right? Or at least increased much, much slower pace, right? So increasingly, you find that there are a lot of young practitioners who are being supervised by people with who lack experience, if you're lucky, to people who are malicious if you're unlucky. And by malicious, I mean to say that, they're not out to harm anyone or anything like that, no. But their intention is not to train, to educate, to teach. The intention is for, let's say, money-making purposes, right? Like we heard of one site where that one site with that one practitioner takes on like 7, 8 young clinicians, like interns. And we realized after a while that the reason why they do that is because it's a money-making endeavor for them, right?
Yeah, because they get the supervisory fees lah.
Correct. And not only that, when they see clients, the interns see their clients, they also charge their clients, and that money goes straight to the company or to the provider, right? So, and then when you hear about the quality of supervision that they get, you hear things like, you come and see me when I got a problem, lah, right? And to me, I'm thinking, how would a young practitioner know when there's a problem when they exactly, right? So then it starts to click like one and one together that, okay, so this is a money-making endeavor. So right, there's very little intent to teach other than me signing off the paper and get the money from the university. That's it, right? And that is horrible because you have students who genuinely want to learn, who want to get into the field, but then they get hamstrung by experiences like this, which is sad. Very, very sad.
So there is the sort of the limit of how many trainees should a supervisor supervise at any given time. I think that's is it an MQA requirement?
Yes, and soon to be Ally Health Act requirement as well, which is I think 1 to 4, if I'm not mistaken. That's right.
Because beyond that, your attention wouldn't be there anymore.
Correct. It's impossible. It's impossible. And I think the horrible part is, right, I've heard of supervisors telling me like, I only see 1 to 4 for university. I'm like, huh? What do you mean? Oh, so if I take 1 to 4 ratio from 4 people from this university A, then I take another 4 from B and then another 4 from C. So I take 12. Okay, great. So I think this points towards the problem, the teaching problems that we have as a profession in terms of governance, right? Yeah. Because now, with the Ally Health Act coming in, with the council coming up, we have a registry of clinical psychologists. Great, good start. But I think the natural development from there would be a registry of supervisors as well. So that when universities reach out to people, say, hey, can you take on my kids and things like that, there is a record or some kind of numbering in place so that I know that, okay, this person already has 3 and I can take 1 more and things like that, to safeguard the young practitioners that we have. If not, then they're just going to pay the price for it again and again and again.
So because I think the 1 to 4 ratio is a good number, I'm not sure how they agreed on the 1 to 4, but 4 I think is a good number because beyond that, the amount of time that I can spend per trainee is already getting quite limited.
Correct.
So if I have to review their recordings, for example,
exactly,
it's actually a very time-consuming process.
And it's not factored into your hours as well.
Yeah,
right? The official hours is just the face-to-face time, right? But all the extra things we did outside, it's not considered, right? So you're right.
So then a supervisor with too many trainees might skip out on some of the things that would be very beneficial for the development of the trainees.
That's right.
The trainees can report anything during the supervision session. I did so and so, but what actually happens in the sessions, that requires some investigation as well.
That's right. I mean, there's so much I learned from watching my own tapes, even though it was super cringe-worthy, right? But you cannot deny that there's so much value and there's so much necessity to watch these kind of videos. When you have 10 supervisors under you, you barely got time. One session takes you an hour. Even if you watch it and you watch it in VLC and double speed also, it takes you about half an hour, 45 minutes, right? You're telling me you got 450 minutes a week just to watch videos alone? No way, right? Then what are the shortcuts that people say? Then supervisors tell the kids, you show me the 15 minutes that you think that I should watch. Again, how is a supervisor supposed to know what are the 15 minutes supposed to watch? Yeah. If I was an unscrupulous student who just wants to pass, I show you my best, of course. Why would I show you my worst and get hammered by you, right? And it just becomes this really horrible scenario where a lot of people are graduating
without having any of their recordings reviewed before.
Yeah, or minimally reviewed. It just breaks my heart.
I remember a supervisor, and I think you had a supervisor before as well. I'm not sure if you had a supervisor during the practicum, but every week I have to upload the recordings.
Oh, yeah. Oh, yeah.
So it's like an accountability thing. Right. I know that I cannot sort of slip through the cracks to wiggle my way out. Yeah. Because I know that this supervisor is going to catch it.
Yeah. Man, catch it, she did.
But I think that this particular issue is not only on the part of the supervisor, it's because also the universities have to meet the requirements. Like I have X amount of students, and by hook or by crook, I must, as part of being on the program, the students need to have a choice of a placement. So then they sort of water down their choices and be more lenient, liberal with the choices that they're making.
And I think that's, I mean, if I borrow from my partner for a little bit, that's one of the reasons why he left academics in the first place, right? When institutions become so financially driven and not quality or care driven, right? This is what happens, right? Who set the number for 30 students per intake per cohort? The money, right? And in most cases, clinical psychology programs are famous for not being profit making one, right?
Yeah, actually, a lot of resources needed.
Exactly, right. But to compensate for that, they say no, cannot be. It doesn't make sense to have a loss making program. So I up the number of students. So again, when it's driven by wrong intentions, or at least different kind of intentions, let's say wrong is a bad word to use. Different kind of intentions, then the outcome is also going to be different, right? Because then you're going to have to make compromises somewhere, and this is what we're seeing right now.
Yeah. Well, I suppose that a loss-making program still makes sense from the university that we are from, because it's a branding thing, like a psychology program from this university, very famous. Yeah. So this adds to that. Yeah. But for a lot of universities right now, psychology isn't their main offering. The program has to be profitable.
That's right.
And I think to give credit to the faculty of the clean psych programs as well, at least from what I know, a lot of them actually do push back on the number of students.
But their hands are tied. Yeah. I mean, at the end of the day, I don't blame them also, because that's their job on the line, right? But at least these are programs with clinicians in it. What about all the programs with no clinicians in it? Oh, that one drives me up the wall, man. I'm like, what in the world is going on?
Sometimes there's a misalignment there, right? Like selection criteria of students, like not from a psychology prerequisite.
Yeah, or making decisions that are not aligned or not beneficial to the clinical students, right? Oh, that one is just, yeah.
So when the student then goes from an environment where there's more students, so then lecturers perhaps don't know them in and out as how our lecturers used to know.
Yep.
And then they go into practicum placements, go into certain placements where the supervisors might be overwhelmed with the number of trainees that they're supervising, or the type of activities that are being logged as hours aren't quality clinical hours.
Yep.
Because that happens as well.
Yep, a lot.
And then they reach towards graduation with those hours, and then they graduate. Yep. So that's the end point the journey for them.
Yep.
And then that comes with the third item that you've mentioned just now, which is the job market.
Yep.
So right now you have a few hundred students graduating every year. What are your thoughts on what's happening then in terms of the job market?
So, I mean, again, I think when we talk about the sense of responsibility, it is what it is. I mean, there's, at every single stage, there are people who are responsible for choices made, and people pay the price for those choices, right? As an end consumer of university programs, I mean to say that I hire these clinicians, right? What we do find is that there is a massive dilution in terms of the skills and the abilities that these graduates have, right? Look, I'm very well aware that I, as a 10-year veteran, right, or the kind of expectations I have on myself and my older team members, my senior team members, for example, cannot be applied to young practitioners. I totally get that, right? So what do? We look at the basic competencies, right? Can sit with the client, can conceptualize, can come up with formulation for intervention and all that. Increasingly, we're getting students who don't even know what these words mean. Right? Like doing interviews, I ask these kids, can you conceptualize the case for me? Right? What's that? Is that the 4P? And I'm like, what do you mean, what is that? How could you not know that word? That's the basis of the work that you do, right? And then they said, 4P, okay, can I have 4P? And then they do some, whatever 4P they do, right? And things like that. Then I was like, okay, great. And from a theoretical perspective, if you do CBT or ACT or whatever it is, can you try conceptualizing based on that? No one taught me how to do that. I don't know how. I'm like, what? Hang on, what's going on, right?
Yeah, so then how do you function, right?
Correct. And these are people, as employers, we are expecting to hire and ask them to see clients independently, because therapy is weird like that, because we can't monitor your work directly, right? Correct. It's only after the fact we can monitor. Will I willingly allow my clients to see a clinician like that? I don't know. I don't think so, right? Because how do I trust that you are able to take care? Don't say do good work, Just be, like you said, do no harm with the client. Even that also I cannot be assured of. So as an end consumer of these graduates, I really am scared. I'm very frightened by it. Now, sometimes people say, "Oh, I know it's the student," and that's true. That's true. To be fair, even in the best universities will have bad students, and even the worst universities will have good students. I totally get that. But when you get 10 people to come in for interviews from X university, and 7 of them are like that, cannot be just the students, right? It has to be the quality of the training as well,
Yeah. Because their journey all along, perhaps they have been not supported adequately.
Yeah.
But the problem now that is being faced, let's say as an employer, is that it is very hard to attribute the accountability to some other party already, because they are the ones that's looking for the job. So they are the ones that are going to be employed. But then, skills are lacking for whatever reason.
Yep.
And by the time they have graduated, now the responsibility is fully on them already.
Yeah, hands off already. That's right.
Which, is an unfortunate situation also lah. So now they are fully responsible for the skill set that they have, but their skill set might be lacking. But they might not necessarily know that their skill sets are lacking because of the prior exposure that they've received.
That's right.
So to them, they think this
enough.
Is a clinical psychologist lah. But from the employer's point of view, it might not be sufficient, especially in our field of work where once you're in the consultation room with the client, privacy and confidentiality. So how do we know what's actually going on? That's might not be possible.
That's right. And I think as a direct or indirect result of that, at the Mind, we tend to not hire externally very often, right? So we try as much as possible. Not try, but what ended up happening is that we will then hire our interns because we train them, we know what they do, and we scrutinize the work to death almost. So when they actually do see clients in their own right as a fully fledged clinical psychologist, we are saying, okay, cool, you go and do it. I know what you're doing, right? And I think that's one of the ways where we try and circumvent this. But that also means that if I only, for me, I famously only train one clinic at one time. That means I only have one new employee at one time, and it's not sustainable, right?
Yeah.
When your business needs grow, you cannot just keep hiring your interns. This is impossible.
I adopt the same approach as well. Most of the clinicians here are all ex-trainees. Right. Because at least I know how they approach their work.
That's right.
How they work with the clients, work ethics and so on. At least for, I've known them for half a year prior to them. Being on board. That's right. Compared to, I think, an initial interview with someone that I don't know.
Yeah. And then I think with interviews, what do you do in interviews? You put your best foot forward, right? And it's a hour long, maybe 2 hours if you're that detail oriented. But even then, you can lie for 2 hours. You can pretend for 2 hours. But when you start seeing clients, that's scary, lah.
Yeah. So I'm thinking if I ever were to hire externally, I think it's going to be a much more intensive process now. Learning from experience, I think perhaps that's what's necessary given the changing sort of landscape of the industry at this time.
Yeah, that's right. Or word of mouth, I guess, like referrals from peers or other colleagues, for example. Then you then there's someone vouching for you, put it that way, right? Then it's a bit more reassurance. But like you said, we still have to go through our own checks and balances and make sure things are okay.
Well, I suppose in this sense, then we've almost taken the student like a passive receiver through this whole journey, right? So and so lecturer.
Fill up my bucket.
After that, placements also, I have problems collecting the hours. Now, when I go for interviews, interviewers say I'm inexperienced.
Yeah.
What can a student do in this whole process for them to increase their chances of being a competent clinician by the end of this? So on an individual basis, what do you think they can do about this?
When you ask that question, I'm just thinking about how when we work with our clients, right, doing therapy and stuff like that. Generally speaking, of course, there are variations between, but generally speaking, therapy, the process of therapy is you find out what's wrong, go and fix it, right? But in order for you to go and fix it, you need to know the problem. And before you know there's a problem, you need to recognize that there are issues to be had, right? And I think for fresh graduates who are trying to top up their bucket, so to speak, on whatever they're lacking and things like that, it's well and good that someone's driven and motivated to get it. But then again, the question is then, if no one tells them what's wrong, how do they know what's wrong? They just don't know, right? And the field is unforgiving in the sense that it's not like you can watch videos of people putting a car together, then okay, and now when I put it in the car, I can fix anything. You can't do that, right? Even if you watch those master clinicians like Judy Beck or Stephen Hayes doing the work that they do, these guys are master practitioners. You are even don't say them like you and I. So 10 years later, we're not even near that level. Right?
Correct.
So I get what you're saying, but I also wonder how are they going to know what they need to top up. And I think that's a big issue, right? Traditionally, when we were studying, that role or that job was filled in by our lecturers, our supervisors, because they had the time, because they had the opportunity and resources to scrutinize the work that we did. Then we know what's lacking, go and fill it up. Great. Now, I don't know. I really don't know where they're going to find out from, unfortunately.
Do you think individual characteristics would matter? I think
yeah,
students would have a much better chance at becoming competent if they started off applying into programs, being more, I think, psychologically aligned with being a clinical psychologist.
Yeah. They're aware, or better aware, I suppose, about what's required, what they want to try and do. But I think that whole idea of intentionality is also important, because if your intentions are from a good place, meaning to say that you want to genuinely help people and things like that, then that pursuit of knowledge or the pursuit of being better is going to be very natural, because
there's an intrinsic motivation.
Correct. As opposed to someone who wants the job because it's a job, and then the motivation is going to tank, right? And then that desire for them to get better or to improve is not there, right? Don't say diminished, it's not there. So you're right, the personal characteristics of a person is important to drive that. But there's also a balance point as well. I'm sure you've had interviews like that or people like that in your team as well, where their desire to get better overwhelms the ability to see clients. It's like, it's like, I cannot see this client until I'm X better. But once they get X better, then it's X, Y better. Then, it just compounds and then they never see clients. And it's like, and then where are we at, right? So it's going to be a balance between that desire to get better, but that excuse the language, I don't know if I can say this, the ballsiness to say, okay, I think I can start seeing clients now as well, right? It has to be a combination of the two.
But it cannot be at the disadvantage of the client, right? So
yes,
I think
that's right.
in our gathering of experience, working with clients, there's always going to be a learning curve.
Yeah.
Where we are learning from our experiences of working with a client. But then, if we get clinicians who may lack certain competencies, the clinician is learning more than the client actually benefiting.
Yeah.
And this sort of lopsided relationship wouldn't work as well.
Yep. Because in the room at least, I'm speaking idealistically, of course. If, like you said, if the clinician is learning more than the client, something's wrong somewhere. Something's very wrong going on.
Well, so intrinsic drive likely, perhaps becomes a motivator in terms of continuous professional development. So perhaps that's one factor to consider.
Yep.
And I think getting into a program, if you are clear, you're not like ambivalent, it's a job, or like, oh, this is likely increase my chances in the future or whatnot. But rather, if you are certain of the realities, I think that's important as well. So the undergraduate interns here do benefit in terms of seeing how the clinical psychologists work. The trainees, what are their responsibilities? What do they have to do? Just overall getting the exposure.
Let's see whether you're right for it or not.
Yeah. Or if it's not here, then, at certain NGOs where they might be passionate about certain populations. I'm not sure if hospitals have any such internships or not.
Not
really. Yeah. But other than that, I think, as a student goes into the master's program, again, the issue here is that you don't know what you don't know, right? But is there anything that the student can do to ensure that they have a higher chance of getting good education of this experience?
I think, again, arming yourself with information and knowledge is vital. So, like, for example, when we choose PhD supervisors or research supervisors, one of the criteria that people suggest or recommend is, how do you put it again? One of the factors that result in good quality outcomes, meaning say like good quality research or good quality graduates, PhD graduates, is the number and quality of people that this supervisor has graduated in the past, right? So the more they do, the more likely that you'll be better quality, right? And I think the same applies for these programs as well, right? Obviously not all programs are created equal, but if you do your research and you ask around, get some good information, I think you start to identify universities with a better track record of training and providing good quality supervision. For example, universities who are driven by good clinical intent, right, rather than anything else. That's a good way to start your journey in that sense. So you pick universities. Obviously, again, universities have different seasons, they got different lectures and all that, but it gives you a better chance, right?
Yeah.
That's one. I think second thing that students can do is to make sure that they are always driven by a desire to know more, that curiosity, right? I think that's also really important to have instilled. It's not enough for you to say, hey, I'm here, I pay you money, you fill my medication, and whatever you give me is enough. I think we're at a point where that's insufficient, right?
But I think it's getting more common now. I think the concept of education seems to be more of a passive receiver,
spoon feeding.
That's right. I absorb rather than to actively seek.
That's right. And I think maybe some other degrees and all that can allow for that kind of passivity, but for this kind of work, you can't, because at the end of the day, let's say even if you have the best lecturers, best resources and all, and you were a passive recipient all the while, when you graduate, you can't sit in the room and expect your client to guide you, right? I mean, obviously we are guided by clients, but we still take a very active role in terms of planning and positioning the work and all that. So if that's the mindset, or that's the processes that you go through as a student, I can't imagine your clinical work going to be much different than that, right? So that's also going to put you at a disadvantage as well. So like you said, I think going into the profession, knowing what it's like or what to expect is also very important as well. I think the more popular psychology as a profession gets, the less people know about, the less that people who come into it understand what it's actually about. People are too caught up with the hype about it, right? Like when I did, I'm sure you're not too far from me as well, because you're one semester down, one cohort down, sorry. But when I started the Clin Psych program on my undergraduate before that, right, I had so many questions on psychology I didn't even know, right? I had to go and find out myself. Like when I did my undergrad, I thought, once I graduate a degree, I can practice. Then I realized, no, you got to do 2 more years of masters. I'm like, crap, what's going on now? So but it's driven by that desire to know more, to get more, to be curious, to be better, right? So when it gets too popular, people say, just do psychology, okay, very good, very happy, you can get money and all that, but there's no desire, there's no intent. And I think that's a big problem.
So to actively seek, being proactive, I think that is one key feature here.
Yeah, it helps, definitely helps.
Yeah, and probably differentiates graduate A and graduate B out in the market as well. There's definitely a very big difference in terms of someone who's more proactive in knowledge seeking than someone who's expecting the supervisor or lecturer to provide. Because I think generally these programs require them to be independent learners also, actually.
Ideally.
So I recall my education where that is the orientation, right?
That's right.
If you don't do, that's your fault.
Yeah, you deal with it, your problem.
Yeah.
That's right.
But what you've mentioned is about the reputation of the training programs. That's one other thing.
Helps.
Which clinical psychology program tends to have a better reputation in terms of having better placements, better supervisors, and so on.
Better track records of these things.
But also, I think the quality of the competency of a clinician really is also determined by the quality of the supervision that they've received.
Oh yeah, massively.
So it's because most of our time is spent in practicum, actually. Where we're logging the hours and we've learned from experience of actually doing the thing. In that context, then the supervision quality matters.
Massively, that's right.
So in this case, then I suppose as a student, what I need to do when I am in the program is that I should be identifying early on who are the supervisors that could actually provide me with the attention, and perhaps the in terms of reputation, their reputation of providing the quality supervision. In order for me to perhaps have a foot in faster than the rest. In terms of getting the quality supervision that I need.
That's right.
In order to develop my competency.
Another thing to add to that, I think we talked about it in the previous episode as well, right? We talked about how finding a business partner is almost like dating, is like a relationship, right? Finding a supervisor is the same thing as well, right? And this is what we tell our clients, you shouldn't be picking a therapist based on the years of experience or expertise that they have. Because even though they're good at their job, if your rapport with them is crap, it's going to be a crap session anyways, right? And I think supervision is also a lot like that as well. at the end of the day, in our field, because it's such a small field, there are prominent supervisory names, right? Like the grandfathers and grandmothers of the field. People all gravitate and flock towards them, understandably, because they're experienced. But if your personality and theirs are like water and oil, what's the inherent point? Because you're just going to dread going for supervision. You're just not going to benefit from it. So I think another component to add to what you said just now, which I think was actually brilliant, the way you said it, like do your research, find out who you want to work with. But also, if you can, I know it's hard, but spend some time speaking to them and see whether you guys fit well as people as well. At the end of the day, this job is it's a human job, it's a human profession. You connect two people together. Supervision is still also the same thing as well. And I think that process of picking a supervisor or a supervisee from our point of view, it has to be with someone that matches you, your vibe, your energy, and all that kind of good stuff. Because if not, there is no point.
Yeah, the supervisory relationship is a relationship at the end of the day.
Yeah.
And with any relationship, there needs to be sort of that fit. Historically speaking, also, there have been trainees where my relationship with them was great, very productive relationship. Some, perhaps
less so.
Yeah, less so. There's different stages of development of relationship. Some might just maintain at a very cordial kind of relationship. Some gets into quite deep work.
Yeah. Which is required for the work that we're doing, right?
But I think in terms of the hierarchy of needs, right, I would think that the first, like the foundational need of the trainee is that the supervisor is available. So the hours that are logged in supervision is according to what's required. My supervisor actually reviews whatever that's needed, case notes, recordings, and all that. That's like sort of the foundation.
Bare bones.
Yeah. So if the supervisor can meet this, that's already a good start.
Yep.
Then next would be, is this supervisor a good fit with me?
That's right. Yeah, that's fair.
So I think just meeting the first layer of
the struggle is
already quite a challenge.
Yeah. And
what more? The next steps to that.
Right. And then it's a product of the age of the profession. Relatively speaking, psychology in Malaysia, clinical psychology in Malaysia at least, it's still a very young profession, right? That also means that you have a generation of supervisors who are supervising out of experience and learning things the hard way, right? There are people who are not actually trained to be supervisors as well, so that also has a disadvantage in that sense, because there are mistakes that we don't need to make, right? Like for example, we go through rigorous training programs in masters and all that. The purpose for that is so that you learn from past mistakes. There's some mistakes you don't make, like confidentiality, like not sleeping with your clients and that kind of thing. We know that for a fact. The same goes with supervision as well. When you have a generation of supervisors who supervise out of good intention, goodwill, and based on their own experience, they are definitely going to make mistakes as supervisors that they don't have to make if they have gone for training, gone for certification and things like that. So I think that's also something that needs to pick up. We are picking up, but only in the past maybe 5 years or so that I hear a lot more of these kind of programs coming up. Prior to that, it's like, oh, you want to be supervisor? Okay, then you find a supervisor to supervise your supervisor. So it's like, I call it super, right? That's the only way you learn. But nowadays, we have a bit more, regimented, more standardized programs, which is a good thing.
Yeah, so the quality of the supervisor would also be dependent on, because like what you mentioned, right, it doesn't translate being a clinician to some other role like an educator.
Yeah.
There needs to be intentional, I think, development in that area as well.
That's right.
So my development as a supervisor too required me to really spend time in developing the supervisory skills.
And I think when you don't do that, right, you also hear a lot of cases where what the family therapists say? It's a generational trauma, right? So you hear people go to really crap supervision themselves, and then they become supervisors, and then they translate that crap experience to the next generation.
Because that's what they know, right?
That's right. That's all they know, and then it just perpetuates. And people, you hear things like saying, "Oh, you need to cry. You have to cry. You have to feel bad in your supervision. If not, you don't learn." Why? This is not a necessary experience for everyone. But because that's all you know, like you said, then that's what they teach. Unfortunately.
Well, so if the student or the candidate in clinical psychology is already in their first semester, second semester, what could really help is that they could identify potential supervisors and, perhaps early on already take that proactive step to establish contact. Sometimes I do receive such emails early, emails from trainees in order for them to, I think, have a head start.
Yeah.
So I think students who are more proactive and maybe have a little bit of a competitive kind of thing.
Desire.
Proactive, I think proactive should be a
proactive,
better word. Because it's really getting the first dips, right? Compared to other trainees who might be applying at the same time.
Yep.
But from what I understand, some universities try to restrict that where they mandate this student has to go to that place. It's not really a choice for the student.
Yeah.
So in that case, I don't really have a solution for them. You just have to accept.
And some universities do that also because they are trying to, again, make sure that their own university needs are met.
Yeah.
Because it's not a good look if their students don't get placements, right? For whatever reason, right? And
so mathematically, I think the university, it all adds up. You have maybe 10 placements and then you have 10 students. Just an example. So each student, if you send to each placement, I solve my problem, right?
If lah.
Yeah. But actually, among the placements, some of them might have a better reputation in terms of supervision and whatnot. It could be a situation where all 10 students apply to the same place.
Yeah, that's right.
So then it creates a shortage and that becomes a problem to the university.
That's right.
So I can see why universities, due to the needs of the program, they would mandate students to go to center A, B, or C.
Yeah.
But perhaps in this regard, not so much to the advantage of the student.
Yeah. And I think I'm an anarchist in the sense that I'm saying that, in the sense that I'm thinking that this profession, maybe I'm definitely biased because like I said, I love clin psych and I feel so much, right, that this is one profession where I think when you're driven by financial intent, the outcomes are very rarely going to be positive, unfortunately.
Yeah, agreeable. Given that of what I went through and me noticing the amount of resources that I consume as part of my training. You had to set up like a whole practice ready for you, and all the tools are very expensive. The supervisors spend their time with you.
That's right.
Definitely is I earn more than what I paid for.
Yeah, I think so. I mean, maybe at that point of time, it was like, please don't look at me, please don't ask me questions. But in hindsight, it's invaluable. There's so many lessons I learned when I was doing my master's that I still think about today. I still hear Dr. Rachel's voice at the back of me. Sometimes I'm doing something questionable. It's like, why are you doing this? I'm like, okay, back up. Yeah, you're absolutely right.
Well, I think today we have discussed mostly about the gaps that we are noticing in terms of the quality of the training.
Yeah.
In terms of the journey, the student journey in clinical psychology. And it might sound a bit bleak. Perhaps as a closing, we want to instill some hope and positivity for students who are thinking they might be a hopeful, in their undergraduate right now. They're thinking, I want to become a psychologist. They really have their fire burning. Or maybe they are a trainee right now, encountering some of the early difficulties that we would expect them to go through due to some of the factors we've talked about today. Or maybe they're out looking for a job at this time. They just graduated, right? So they are hopeful that they want to build a life moving forward. What would be some advice or any sort of words of encouragement that you might want to give to these hopefuls?
I think for me, not advice, but the idea that I hope to instill is this, right? Does it matter where you came from? Yes. So meaning you say your foundational training, does that matter? Yes, of course it does. But it doesn't determine who you become, right? And but with that, I'm trying to allude to the fact that your ability to grow as a clinician never stops, right? So maybe you came from a university that gave you less resources, less training, less attention, less whatever. We're fine, whatever. It is what it is. You cannot change that. But that doesn't stop you moving forward from filling in the gaps, from continuously growing. So as long as you don't think that you're the finished product and you think that there's always that capacity to grow and change and get better, you're on the right track, right? So it's not all doom and gloom in that sense, right? Even as an employer, so I can recognize, or we do recognize, people who think that they're the finished item already and think that there's nothing else to grow, versus someone who is, maybe lacking in some areas and things like that, but the desire to grow is much better. We recognize that as well. We understand that is a reality that we are facing, no choice. And for me as an employer, I pick student B over student A because then I know that this person can learn and has desire to learn. So it's not all doom and gloom in that regard if you are driven by that desire to continuously grow and improve, right? If you have that, I think you should be okay.
Yeah, and I completely agree with that. And this speaks to some of the things that we spoke about earlier about having the intrinsic drive, having a clear idea of what to expect, and being proactive. And that what is the truth with regards to a profession is that the learning never stops.
Yeah.
Right. So 5 years in or new 5 years in, 10 years in, you're still always learning in the therapy room. It doesn't stop. So I suppose having that mindset is really going to help.
Definitely.
Give an edge.
Yeah. So good luck to everyone who's practicing out there. Good luck. Keep going. Don't stop. And see where you go from there.
Okay. So thanks, Joel, for coming today.
No worries. Thanks for having me, man.
Good episode.
It was good fun.
Yeah.
Thank you.
Thank you. Thank you for tuning in to this episode of Be Kind to Your Mind. Found this content educational? Hit the subscribe button to stay updated on new episodes every 2 weeks.